Kicking off our event today, I would like to introduce our keynote speaker, Stacey Lee. Stacey is a professor of law and ethics at the Johns Hopkins University Carey Business School with a joint appointment at the Bloomberg School of Public Health. She will discuss how the patient and caregiver voice can be used to empower individuals in their health and eye care journey. Please welcome Stacey Lee.
Great, and thank you for that welcome. I'd like to just give a visual description to accompany my voice. I am an African-American woman in her mid-50s. I have long, straight brown hair. I'm wearing a blue shirt, and I'm really very excited to have the opportunity to chat with you today. And I stand before you today not just as a speaker, but as a storyteller and an advocate, and a fellow traveler on this journey of understanding and empathy. My perspective has been shaped by my experiences as a health law professor, a former litigator, but perhaps most profoundly as the caregiver to my late father, who navigated the challenges of glaucoma along with home dialysis, Parkinson's, all before his passing. I'd like for you to imagine for a moment that you're in a room filled with a symphony of sounds, but the conductor is invisible and the orchestra unseen. This is the daily reality for millions who navigate life without sight. My father's journey and my privilege to accompany him on that illuminated for me the daily realities faced by those with visual impairments. Despite the obstacles he encountered, my father's resilience, coupled with the unwavering support of family and healthcare providers, allowed him to adapt and persevere. However, his struggles within the healthcare system, from inaccessible medical devices to a lack of understanding about his unique needs, underscored for me the critical importance of advocacy and systematic change. And we're going to talk about the patient voice. Because you see, my dad's journey, like many of those with visual impairments, was littered with obstacles, particularly within the healthcare sector, a system that should be a sanctuary of care, yet oftentimes becomes a maze of barriers. And navigating these complexities of home dialysis while managing glaucoma was a constant challenge. I recall the frustration he felt when his dialysis machine's digital interface was incompatible with his screen reader, or when his healthcare provider failed to fully grasp the implications of his visual impairment on his treatment plan. When my dad became unable to walk, the response was immediate. As he progressed through the stages of glaucoma, that same type of awareness and incorporating that into his care plan, as we dealt with pharmacies, as we dealt with physical therapists, as we dealt with getting prescriptions, was not on the same level at all. Now, I do want to point out that there were some highlights. For example, there is an opportunity when my dad, who had gone from being able to see 20/20 vision for the majority of his life to the gradual stages of not being able to see, went to see a new ophthalmologist. When we got there, the ophthalmologist took the time by taking my dad's hand and placing it over a model of an eye and gliding it to the different points as he explained how the eye works. It was that type of simple interaction that helped my dad better adjust and understand the progression that he was going through as he was slowly losing his sight. It was those experiences, coupled with his other health challenges, that for me fueled my determination to be a vocal advocate not just for my dad, but for the entire visually impaired community. Now, the statistics paint a grim picture. Adults with vision impairment are less likely to have adequate health insurance coverage, a usual healthcare provider, or a dental visit in the past year. And they're more likely to have unmet healthcare needs due to cost. But behind every number that I'm talking about is a person, a story, a struggle. And like my father, each individual navigating this system is a testament to the power of resilience and the necessity of change. This is where we, as a society, have a crucial role to play. We need to shift our perspective from seeing visual impairment as a limitation to recognizing it as a different way of navigating the world. This means taking the time to learn about the unique needs of visually impaired individuals and finding ways to make our healthcare practices and environments more accessible and inclusive. So, it can start with something as simple as healthcare providers offering to read aloud the forms that need to be filled out, or providing audio descriptions of the layout of the exam room. It means that ensuring that websites and patient portals are compatible with screen reader technology and that the staff are trained on how to guide a visually impaired person safely and respectfully. But here's the thing, accessibility goes beyond just the physical environment. It's about the way we communicate, the language that we use. We need to be clear, concise, and avoid medical jargon. We need to take the time to explain procedures step by step and ensure that patients understand their treatment options. And most importantly, we need to listen, really listen to the concerns and experiences of visually impaired patients. This is the kind of patient-centered care we should all be striving for. Now, it's not always easy, and it requires us to step out of our comfort zones and challenge our assumptions. But the impact, when we do this, can be immeasurable. The challenges of visually impaired individuals also highlight the vital role of advocacy organizations and the role they play in this community. Groups like the American Foundation for the Blind, ABF, and the National Federation for the Blind, NFB, have been instrumental in pushing for progress and systematic change. The ABF has led efforts to make technology more accessible, standardized Braille codes, and published critical resources for the visually impaired. The NFB, as the oldest and largest organization led by blind people in the US, has tirelessly advocated for laws that ensure that the rights and independence of blind individuals are enhanced and maintained. These organizations provide a powerful voice for the community and serve as essential allies in the fight for healthcare equality. But the work is far from over. As Jeff mentioned, there have been recent legal and legislative victories, such as ensuring accessibility in education, employment, and in digital spaces. Yet they also remind us that there is still an ongoing struggle for full inclusion and equality. As allies, we must continue to educate ourselves, speak out against injustice, and support the visually impaired community in their own advocacy efforts. For those of you who are visually impaired, I want to emphasize the importance of being your own strongest advocate. And in doing so, here are 5 actionable steps you can take to advocate for yourself in the healthcare system. The first, know your rights. Familiarize yourself with the American Disabilities Act, or the ADA. As an attorney and a healthcare law professor, this was second nature to me. However, knowing it as a practitioner versus reading it through the lens of a caregiver, when I began taking on and over the care for my dad, was a radically different perspective. These are laws that protect your rights to equal access to accommodations and healthcare in the healthcare setting. Number 2, communicate your needs clearly. Don't hesitate to inform healthcare providers about your visual impairment and your specific accommodations that you require. That was a conversation I was having with physical therapists, with people at the dialysis center, with people who are treating my dad's Parkinson over and over again. In their effort to focus on a specific ailment, Parkinson's, dialysis, they turned we'll use the term of voice, a blind eye to the fact that my father's vision was increasingly getting worse, and that his inability to be able to see, read, and digest information on a visual level had serious ramifications to the care plan that they were recommending. So communicate your needs clearly, be direct, and be assertive in that communication. Number 3, request accessible formats. And whether that's medical forms, educational materials, billing statements, you have the right to receive information in a format that's accessible to you, such as large print, braille, or electronic formats with screen readers. Bring a support team. If you feel comfortable, bring a trusted friend or family member to advocate when you go to your medical appointments. They can help you take notes, ask questions, and ensure that your needs are being met. Number 5, if you encounter discrimination or barriers to access, don't be afraid to file a complaint with the appropriate agencies, such as the Civil Rights Division of Health and Human Services. Holding healthcare providers accountable is crucial for driving change. Something that I want you to keep in mind. Remember, you are the expert on your own needs and experiences. Trust your instincts and don't settle for subpar care. By advocating for yourself, you not only improve your own health experience, but you also pave the way for a more inclusive and equitable system for all. Now, I want to make a real point here. Advocacy doesn't stop at the doctor's office. It's also crucial to advocate when we're dealing with insurance companies. Navigating the complex world of health insurance can be daunting for anyone, but for those with visual impairments, it can be especially challenging. Insurance policies are often written in complex legal jargon, and the process of filing claims and appealing denials can be a bureaucratic nightmare, regardless of where you fall on the vision spectrum. As a result, that's why it is so important to know your rights and to advocate for yourself with your insurer. Again, under the ADA, insurance companies are prohibited from discriminating against individuals with disabilities, including those with visual impairments. What that means is that they must provide policy documents and other important information in accessible formats. Again, they must ensure that their websites and mobile apps are compatible with assistive technologies. And if they don't, bring that to their attention and ask for the appropriate accommodations. In fact, don't be afraid to speak out. Reach out to your insurer's customer service department and explain your situation. If you're not satisfied with the response, again, be your own advocate and consider filing a complaint with your state's insurance commissioner or the Department of Justice's Civil Rights Division. I can't stress enough, you have the right to equal access and fair treatment from your insurance company. By advocating for yourself and holding them accountable, you can help ensure that everyone, regardless of their visual ability, can access the healthcare coverage they need and deserve. Now, change must happen on every level and in every sphere that impacts the health and well-being of those with vision loss. It's not just about making healthcare facilities more accessible, though that's undoubtedly critical. It's also about advocating for better educational support to equip individuals with the tools they need to manage their health. It's about pushing for improved surveillance, about public health interventions to catch vision problems early and prevent unnecessary deterioration. Again, I go back to my dad's progression through glaucoma. When you see kidney failure, when you see a person's physical inability to be as mobile, I feel that the health industry mobilizes very quickly. As my dad's vision slowly began to deteriorate, he was less focused on, assuming that it was part of the aging process, what was going on. And I'm often left of, were there preventative things that we could have done earlier? Staying on top of something that's an incurable disease is something that I really encourage you to be vigilant about. This is about being a vocal presence in also the development of new treatment, therapies, and assistive technologies, ensuring that the needs of the visually impaired communities are always on the forefront. And in that regard, organizations like Prevent Blindness are playing a vital role in this multifaceted approach. By training patient advocates to be effective change at the personal, community, state, and national levels, Prevent Blindness is amplifying the voices of those directly affected and driving process and progress on multiple fronts. Whether it's an individual advocating for their own care, a community pushing for better transportation services, a state passing laws to increase funding and support, or advocates on Capitol Hill fighting for more comprehensive Medicare benefits, every action contributes to a more inclusive and equitable system. Another way that Prevent Blindness is doing great work is by bridging the gap between the visually impaired community and those developing technologies and treatments for tomorrow. By providing a platform like today and other platforms for advocates to offer feedback directly to tech and pharma companies, They are helping to ensure that new innovations are accessible and responsive to the real needs of those living with vision loss. Now, of course, the responsibility for improving healthcare accessibility doesn't just fall on individual providers, patients, or insurers. It requires systematic change, policy initiatives, and resource allocation. This is where policy advocacy comes in. On a legislative front, there have been some promising developments in recent years. The Medical Device Non-Visual Accessibility Act, introduced by Senators Hassan and Brunner, is a bipartisan effort to improve the accessibility of medical devices for blind and visually impaired. If passed, this bill would require the FDA to develop rules around ensuring that new medical devices with digital displays include accessibility features. As someone who helped my dad with his peritoneal dialysis every day, having that type of interface would have been critical. Another crucial area where advocacy plays a vital role is in the pharmaceutical, biotech, and drug development process. For visually impaired individuals, access to safe, effective, and accessible medications and treatments is paramount. However, the journey from lab to patient is often fraught with challenges and barriers. One of the key issues is the lack of inclusion and representation of visually impaired individuals in clinical trials. Historical exclusion has led to a dearth of data of the safety and efficacy of medications in this population. Advocates are working tirelessly to change this, pushing for greater diversity and accessibility in clinical research. We need to applaud and encourage more in this area. Organizations like the Foundation Fighting Blindness are at the forefront of this effort. They are funding cutting-edge research, partnering with industry leaders, and advocating for policies that prioritize the needs of visually impaired communities in drug development. By ensuring that the voices and experiences of visually impaired individuals are heard and valued throughout this process, we can work towards treatments and cures that are truly inclusive and transformative. But here's the thing. Advocacy doesn't just stop at the developmental phase. Ensuring accessible delivery and administration of medications is equally critical. This includes everything from accessible labeling and packaging to the development of assistant devices for medication management. I want you to, for a second, imagine the challenges of managing multiple medications without the ability to read labels or distinguish between pills. Or the annoyance of having to do extra work on top of managing your diagnosis just so you can create your own workaround to ensure that there are safety measures that accompany you taking your medication. My dad had an advocate who could see, who was a lawyer, who had the time to devote to helping him through this process. The system needs to be equipped to help individuals without a family member or another advocate with a health law background to help them. So, as advocates, we need to work and push for greater education because for the visually impaired. It's a daily reality that the challenges that I just mentioned of inability to read labels, distinguish between pills is a daily challenge. Innovations like talking prescription labels, braille packaging, and smart pill organizers can make a world of difference. But these solutions won't become widely available without the tireless work of advocates demanding change. So, as advocates, we also have to push for greater education and training for healthcare professionals on the unique medication needs of the visually impaired. From techniques for safely administering eye drops to strategies for communicating dosage requirements, equipping providers with the knowledge and the skills to serve this population effectively is just essential. Advocacy in pharmaceutical and biotech space is about more than just advancing scientific progress. It's about ensuring that the fruits of that progress is accessible to all, regardless of visual ability. It's about creating a future where no one is left behind in the quest for health and well-being. So let's add our voices to this crucial conversation. Let's advocate for greater inclusion, accessibility, and equity in every stage of the pharmaceutical journey. Together, we can build a future where visually impaired individuals have the tools, the treatment, and the support they need to live their fullest lives. But there's so much more to be done. We need to contribute to pushing for policies that prioritize accessibility, that recognize unique needs of the visually impaired community. We need to advocate for increased funding for research on eye diseases and treatments, and for the development of new assistive technologies. But most importantly, we need to amplify the voices of those directly affected. We need to look to create or provide community platforms for the visually impaired, for them to share their stories, their struggles, and their triumphs. Because it's through their personal narratives that we can truly begin to understand and empathize. This is where each and every one of us has a role to play. Whether you're a healthcare provider, a policymaker, an educator, or simply a concerned citizen, there are steps that you can take to become an ally and an advocate. And I'd like to go through a couple. Again, as an ally, we need to learn about the challenges of the visually impaired community and the resources available to support them. It's important to learn about the whole community with cultural humility, taking care to learn about the challenges that my own ideas and challenge my own ideas of what blindness is or what the experiences of blind people are. The more informed we are, the better equipped we are to make a difference. Again, I can't speak highly enough about the need to speak up. If you witness accessibility barriers or discrimination, don't stay silent. Advocate for change within your organization or your community, and support advocacy organizations. Consider donating to or volunteering with groups like Prevent Blindness and the Foundation for Fighting Blindness, which has been working tirelessly to advance the rights of the visually impaired. But also consider donating to organizations that are designed and managed by the community itself, such as the NFB and the ACB. Also, champion inclusive design. If you're involved in the development of healthcare products or services, prioritize accessibility from the start. Engage with visually impaired individuals to understand their needs and incorporate their feedback. However, come to think about it, I think I want to challenge you to even go a step further. Hire disabled individuals so they can do the building. It is more resourceful and in tune with the needs of the actual community when they partner with and are involved in the building rather than being asked to tweak something that a sighted person has built for them. Sighted people are depriving themselves, me included, when they don't view blind people as equal participants that are capable of enriching the work and the lives of the design process. Next, foster empathy. Take the time to really listen to the experiences of those living with visual impairments. Provide platforms for them to share their stories and break down the stigmas and misconceptions. Or if you are talking about the needs or the experiences of a blind person, make sure that you preface it by the fact that you are using your own interpretation for their experience. I shared with you a little bit about my father, my dad's journey, and the journey of countless others like him serve as a constant reminder of the work that still lies ahead. But they are also a testament to the tireless human spirit and the incredible progress that is possible when we unite in advocacy and commitment to change. So, as I wind down today, I want us to do it with a renewed sense of purpose. Let's honor the struggles and the triumphs of those navigating life with vision loss by being unwavering in our pursuit of a world that is truly inclusive and accessible to all. Let us advocate fiercely, listen intently, and work collaboratively to dismantle the barriers that hinder equity in health and well-being. Together, we have the power to create a world where no individual, blind or not, is left to navigate the path of health alone. A future where comprehensive support, cutting-edge treatments, and unconditional empathy are the norm, not the exception. This is the future that my father fought for, one that I'm committed to being an advocate to help bring into reality. Finally, this is the future we must all commit to building. One day, one advocacy effort, one act of empathy at a time. Thank you so much for having for me and providing me the opportunity to speak with you today.
Thank you so much, Stacey, for sharing your journey with your father, his glaucoma experience, and how those listening today can make a difference. You know, as you were speaking, really at the heart of your speech was the fact that at the heart of a dream for equitable healthcare is that no one should have to rely on luck for their healthcare. Someone shouldn't have to be lucky enough to have a daughter who has expertise in the law and healthcare in order to receive excellent healthcare. So I think, you know, it really came through well in your remarks. What I'd like to do now, though, is introduce our reaction panel to have a discussion, continue this important discussion. With us today, we have Tom Brunner. He's the president and CEO of the Glaucoma Research Foundation. Amy Magro, who is the executive director of patient advocacy at Amgen Rare Disease, and Dr. Nazanin Heydarian, assistant professor at the University of Texas Rio Grande Valley School of Social Work. They'll share their points of view around the importance of the patient voice from an eye health organization, pharmaceutical company, and researcher perspective. And don't forget, please submit your questions through the Q&A button at the bottom of the screen. We already have several there. And we will ask those of Stacey and some of the members of the reaction panel. But before we get to the questions, Tom, would you tell us a little bit about the Glaucoma Research Foundation and how you include the patient or caregiver voice in the work that you do?
Definitely, Jeff. Thank you for the opportunity. I'm Tom Brunner, and I'm the president and CEO of Glaucoma Research Foundation. I'm an 83-year young white male with short gray thinning hair, wearing glasses, a light blue shirt and tie, and a sport coat. My virtual background is a daylight view of the Golden Gate Bridge with San Francisco in the background, since Glaucoma Research Foundation was founded there in 1978 by 3 glaucoma specialists and 2 empowered glaucoma patients. One of those, Blanche Mathias, encouraged the doctors to start their foundation and paid the legal expenses to incorporate it. She then left them a $1 million bequest to further their efforts. Our mission then and now is to cure glaucoma and restore vision through innovative research. Since the beginning, our focus has always been on patients and helping them preserve their vision through improved therapies, as well as education and advocacy. Our patient-centered approach starts with including patients on our board of directors, as members of our committees, including our research committee and our planning and steering committees, as well as moderators and panelists at our annual patient summit and Glaucoma 360 innovation meetings. Our education and communication committee also includes glaucoma patients and providers who review and make recommendations for our monthly e-newsletter, Gleams, our website, and our booklet, Understanding and Living with Glaucoma, which is free and available in Spanish and English on our website, glaucoma.org, or by mail, and most recently as an audiobook. In addition, we do annual patient and caregiver surveys to get feedback on our educational material and learn of unmet patient needs. As Stacey said, there is still much to do to assure equal access, and we look forward to learning more at this summit.
Thank you so much, Tom, and thanks to you and Stacey for the reminder of giving a visual description. I'm a middle-aged Caucasian male wearing a black shirt, a pair of glasses. I have a beard. I'm before a brick wall with a clock on it that has been eternally broken, and so it's stuck at 9 o'clock at all times. So don't go by that clock. And now I'd like to welcome Amy. Amy, would you share a little bit about your role at Amgen and why you feel it's important for pharma and bio to include the patient or caregiver voice in the drug development process and delivery process?
Yes, thank you, Jeff. Hello, everyone. My name is Amy Magro. I'm the Executive Director of Patient Advocacy at Amgen Rare Disease, formerly known as Horizon Therapeutics. I'm a female in my late 50s. I have medium length straight blonde hair and I wear glasses. At Amgen, our mission is really clear. It's serving patients with serious illness. In my role in patient advocacy, I work closely with patient advocacy organizations, as well as individual patients and care partners in various rare disease communities to understand gaps and barriers in care and resources and determine how we can provide support. This support could be programs from Amgen, or in many cases, it can be our supporting the efforts of patient advocacy organizations like Prevent Blindness to connect communities, to elevate the patient voice and provide resources. Our mantra at Amgen is participate, listen, and learn from patients, their care partners, and advocacy organizations. They have the lived experience. They are the experts. In my role, I could work in a disease area for years and never fully understand it as well as someone who lives with the challenges of that rare disease every day. Focusing on elevating the patient voice is critical to the work that we do in pharma and biotech, and that is especially true for those of us who work in rare diseases. Here's just a few statistics to put this in context. 95% of rare diseases don't have an FDA-approved treatment. Oftentimes, there's very limited medical expertise and research in that rare disease. Patients are 3 times more likely to report feeling anxiety and depression. And on average, it can take 5 years to get an accurate diagnosis. I share this with you because it sets the stage regarding elevating the patient voice in drug development. At Amgen, we have a treatment in development for disease state with no FDA-approved treatments. And this is the first randomized controlled trial in this disease area. There's no playbook here. We worked with physicians from around the world who are experts in the field, and we developed a clinical trial. We then shared that trial design with patients and care partners, and they provided some incredibly important insights that really changed the way we approached the trial. First, they shared that we were thinking about the patient population we were including in way too narrow of a way. We weren't representing the full spectrum of the various patient types with this disease, including patients with visual impairments. Secondly, the patients gave us feedback that we weren't including one of the most important consideration of what it's like to live day to day with this condition. This is the data the community would be most interested in, and we weren't even thinking about including it. Based on that feedback, we changed the trial design, we broadened the patient population we were studying, and we added another primary endpoint that wasn't even on our radar before. The bottom line, hopefully, we will be providing better data by which healthcare providers and patients make decisions about their care. We also closed the loop with the patients we work with to let them know what a difference their voice had made and how we move forward with this trial. Sometimes it works out that we can't always action on the feedback that we get from patients, but we'll share that as well. Because this is about us working to build an inclusive community where all the stakeholders have a voice. I'm going to share just one more quick example. We work in another disease area that's associated with significant vision loss. We have an established standing advisory board of patients and care partners, and we meet with them regularly to get their feedback on a variety of topics and initiatives that we're working on at Amgen. Our marketing team was working on an education piece for patients, and it had an illustration of double vision. We shared that with the patients in the room, and it went very quiet, which that was unusual for this group. Finally, one of the patients spoke up and said, "This is not at all how we experience double vision. It's not just as simple as 2 mirrored images imposed on one another." The group went on to share how they experience double vision and how we should be representing it out into the community more accurately. Because none of us working in this piece or on this piece had ever experienced double vision, we couldn't assume that we knew what that looked like. These are just 2 great reminders, I think, of how important it is that in pharma that we continue to give patients and care partners the space to be seen and be heard, and ultimately empower change. A lot of what Stacey talked about in her talk. So thanks for the opportunity to share some of this.
Thanks, Amy. And I should probably take the opportunity now to disclose that in addition to supporting this summit, Amgen and Horizon before then do support a number of programs that prevent blindness, and as do other pharmaceutical and bio companies. And that support, while it helps provide funding for many of our programs, those relationships also help give us the opportunity to bring the patient voice to bear with the pharma community. That's an important relationship. I think it's a central relationship, the one between patient advocacy organizations and pharmaceutical companies, and helping make sure that the patient voice is brought to bear in drug development. So now I'd like to turn to Dr. Heydarian. Doctor, would you please tell us a little bit about your research and how you've included the patient or caregiver voice in it?
Of course. Thank you, Jeff. So first of all, I am a young-ish adult Persian American woman in her mid-30s. I have light brown skin and dark brown hair pulled up in a bun today. And I'm wearing black and gold glasses and a burnt orange dress with white stripes going across it. And to the first part of your question, as far as my research, so in my research, I examined the experiences of blind people with stigma and ableism in their interactions with their healthcare providers. I also characterize health disparities in the blind community. Recently, I've been focusing on diabetes management and just making sure those tools and things are accessible, and that diabetes educators are well aware of how to work with their blind and low vision clients. I conduct longitudinal research. As far as the caregiver side, this is more focused on caregivers of children with intellectual and developmental disabilities, but I think there are probably some common themes that would go across, generalize over to caregiving for blind and low vision children. And I've worked with over, as far as your question or the part of your question on engaging the patient voice, I've worked with over 600 blind and low vision people in my research. I take a methodical approach to improving accessibility and reaching the community in spaces where they are. So, for example, Professor Lee mentioned some of these, like the organizations such as Prevent Blindness, as well as the National Federation of the Blind, the American Council of the Blind, and constant feedback is key. So just getting constant feedback on participants about the methodology, the different surveys, features that we use, because technology is constantly changing. Accessibility isn't something that you can sort of check a box. It's actually quite dynamic. Different people have different needs, they use different tools, and those different tools interact with different platforms differently. So constant feedback is key.
Well, thank you so much for sharing that. I think that last point is really so central to this, is that, you know, just as healthcare is constantly evolving, so is, you know, how we advocate for ourselves and patients, and we always have to stay on top of all of this. I'd like to turn a little bit to the Q&A now. A friend of ours just typed in, where and when should the education be provided to healthcare professionals during schooling as CME? Should patients be involved in that educational experience? Stacey or others, do you have any thoughts on that?
I would like to have it part of the medical school curriculum. The providers, when they begin meeting with patients and working, it should be second nature to them. Trying to catch up on it as a required CME is a little too late. I love the idea of it becoming an established part of your practice from day one.
Yeah, I couldn't agree more. Yeah.
I would just add to, I agree 100% there. And Also, the importance of including the patient narrative and the patient journey as part of that education. Again, working in rare disease, maybe they only see, a handful of patients a year. They may not remember what they learned in med school, but they'll remember a story that a patient shared. Or we've seen this, especially in patients that have visual impairment. Physicians don't always equate the symptoms with the impact on the quality of life. And as a patient tells their story and what their day-to-day life is like with this particular condition, I think that's where you really see the light bulbs. So trying to get patients and physicians together as often as possible in that teaching capacity is really, really important.
This
I
is
think that's-
Naz. Oh,
Go ahead.
Oh, I was going to say, I agree. Yes to all of the above. Should certainly be a part of medical training and then ongoing training, and should definitely center the patient voice. One sort of shocking statistic that I came across that is related to intellectual and developmental disabilities, but I wouldn't be surprised if we'd see similar numbers if we asked and looked into medical school curriculum to see how much time is dedicated to other types of disabilities. But on average, medical students learn like 11 minutes of content in their whole career about intellectual and developmental disabilities. So there's just not enough there. And there's just not enough going on to learn how to, engage with the person they're sitting.
Yeah, I think one of the things that I would just share is it's so important for us to make sure that, just as you suggested, that all healthcare professions should spend time on getting to know and learn about visual disabilities. For example, at Prevent Blindness, we're doing some work to make sure that primary care providers understand, visual disabilities and how their work can impact that, and as well as mental health providers. Certainly there's a lot of crossover there, and we need to ensure that mental health providers understand how to treat people with vision impairments and understand some of the particular challenges and opportunities that may come with those challenges. Tom, did you have a comment?
Yes, I was just going to say we recently held our patient summit in Philadelphia and had both patients and providers on panels and in discussions. And it was fascinating. And I think to Amy's point, and certainly to Stacey's, that the storytelling is just so critical. But I can't tell you how often the providers were saying, I never realized the impact of this or this problem. And hearing it directly from a patient who might be a speaker or on a panel or whatever has a huge impact. The question is, how do we package that and get it more broadly, create broader awareness, I guess. And I think, Jeff, to your credit, that's what you're doing with this meeting and with others. But it's really, I think it's going to be very difficult, frankly, to get the medical education group to bring this in, if you will. And I think we have to be creative in finding other ways to get the medical profession to see what's going on. And I think Amy or Stacey, in your comments, I was particularly impressed with your discussion of glaucoma being, and Parkinson's as well, are both progressive diseases. And so the patient themselves and the providers may not realize the worsening conditions. And just for example, we had a board member with glaucoma who had to give up one of his favorite things was hiking. And it was because of changes in contrast sensitivity from glaucoma. So he could still drive and read and he was fine, but it was hard for him to see steps or rocks on a path or whatever. And that's a gradual change. And I think that happens perhaps with many disabilities. And again, just requires education. So.
Yeah, I recall, even with my own provider, in the 10-15 minute window we have in there, there's often this conversation about, what are my symptoms, what's going on with the healthcare condition, but not how that symptom or whatever is impacting my daily life outside of the office. And I think there needs to be more of that discussion. But it also goes into how do we create a system where the healthcare provider has more than 10 minutes with the patient? And that none of us are going to answer that question here today. Another question that came up: what do you do when the doctor says there is nothing I can do for you or your condition? When a patient comes in with a devastating condition, that's the last thing they wish to hear.
I don't want to do all the talking, but I just have to say if we could solve that one problem, it would be huge. And it's a miscommunication, because when a doctor says there's nothing more I can do, he doesn't really mean there's nothing more he can do. It means in his toolbox, there's nothing left. But there's a lot he could do. He could refer them to an organization. He could refer them to the National Foundation for the Blind. He could refer them to low vision specialists, which is the first thing he ought to do. So changing the language there, again, it's an education issue. But Stacey, you probably have some good comments to that question too.
I just want to echo what you've said. The statement or the diagnosis, there's nothing more I can do, was never one that was acceptable to me. Yes, there is no cure for glaucoma. Got that. However, there are things that my dad enjoys doing. He enjoys playing cards. So how can something you can do is, okay, let's figure out how can he retain the activities that he enjoys, because buying into that diagnosis of there's nothing more that could be done on some level gives a patient permission to let go. And I would really like to broaden the conversation that there's nothing more I can do, maybe from a specific medical intervention, but there is so much more to someone's wellness than a pill or a surgery for their particular diagnosis.
And I think that's also where patient support groups help, because talking with other patients and finding out how they're dealing with this progressive loss of abilities.
Stacey, I'm curious, I have a question. We've talked about advocating to, pharmaceutical companies and policymakers and healthcare providers. How does a family member advocate to the patient themselves? How do family members advocate for their loved one's healthcare when maybe the patient themselves may be resistant to that? And I think we see some of that often, especially in elderly populations where they may have given up. What's the role of the caregiver and family member there?
I think that's an excellent question. And a little bit of background about my father: career Army officer, colonel in the Army, with a very specific mindset of being independent and taking care of himself. Losing the ability to walk, devastating. Losing the ability to see put him in a state of vulnerability that required a ton of intervention and getting him to find an inner resolve to, hey, you need to hang around. And it requires, what can you do? What are the ways that we can accommodate you? And just having that support system. I'm effective as his daughter, but for me, what was incredible is he came to live with us, the voice of his grandkids, and feeling needed. So it was an entirely different type of learning for me. The easy part, I think, was learning about the disease, because I can do that in a dispassionate way. I can read medical journals, I can talk to healthcare providers, but taking that knowledge and then translating it into a way that was going to help my dad. How do you learning new skills of, I can't just go into his room and do something. Just like the visual description I gave when I started my talk, "Hey, Dad, it's really cold outside. I am now going over to your dialysis machine. I'm setting it up. Hey, I can't remember. What button do I push or what dosage?" Having him be active participants is incredibly important in this process. So, we talk about changing the medical school curriculum. There needs to be a ton of education, and there is, but making sure that providers steer families to those resources to equip them with the appropriate language and skills to make sure that their loved one wants to be an active participant in the system is critical.
I would just add too, we talk a lot about connecting patients, that care partner component is so critical. And again, especially if you have a progressive condition, what does that look like now? And talking to other care partners who are maybe further down the road in that journey. So you're not trying to figure it out all on your own. There are other people out there that again have that lived experience and can help provide some of that guidance. So as much as the patients are clearly critical to be connected, care partners are also critical to connect with one another and provide that support.
This is Naz.
Yeah, Naz.
Sorry, I'm always like interrupting. But I just wanted to add to this discussion about connecting people with resources. I also wanted to highlight the importance of, so Professor Lee talked about this experience that your father had early on with an ophthalmologist who was able to, and this is just, something that it blew me away a bit, was that he had the knowledge, the idea to just give your father a more meaningful experience of that medical education by being accommodating, by giving him the experience of using the physical model of the eye. And it's this part about knowing sort of how and when to refer and where to refer patients out to, so they can sort of build these skills that are important for continuing the quality of life is important, but also having some sort of skills and knowledge about how to make the medical appointment itself meaningful for diverse patients. And that could look like how your ophthalmologist used that model, or how your father's ophthalmologist used a model, doing things like describing where things are in the room. And I'm pretty open about my experience as a blind person who's going through prenatal care right now. Just sort of having things like if doctors would sort of offer to describe an ultrasound to you. So things like that to make that what you're doing in the clinic visit accessible and more patient-centered, rather than sort of focusing on oh, this patient is sort of like a hazard or a liability, or just somebody who's experiencing, unfortunate things, and just sort of focusing on usually what people believe are the struggles of blind people. You could be focusing instead on, okay, so here's a patient, a unique patient in front of me. How do I make this experience as engaging and memorable as possible as a healthcare professional?
Thanks, Naz. And I think, unfortunately, we have to wrap this up here. We have other questions, but in the chat, but please, there will be an opportunity to continue those in a chat room. So I would like to thank today's panelists and all of you for joining us.